Most men don't realize it, but some of the earliest signs of prostate issues are so subtle they slip right under the radar. It's not that they're invisible, it's just that they look like everyday occurrences. A bit more fatigue than usual, a couple of late-night trips to the bathroom, or even just a general feeling of something being off. But these small signals, they matter. Because in many cases, they're the body's first quiet whispers that the prostate isn't functioning the way it should. And before we go any further, here's something important. At the very end of this content, I'll be revealing a powerful, yet often overlooked natural ingredient that, when prepared correctly, can support prostate health in an incredibly effective way. But here's the catch. If it's used the wrong way, it won't just be ineffective. It might even set your progress back. So, stick with me. Especially when it comes to health, missing just one key step can make all the difference. Let's take a moment to understand why this matters so much. The prostate is a small gland, roughly the size of a walnut, sitting just below the bladder. Despite its size, it plays a huge role in male health, affecting everything from urinary flow to reproductive function. And when it starts to malfunction, the consequences go far beyond inconvenience. We're talking about real, tangible impacts on daily life: interrupted sleep, decreased energy, even reduced confidence in social settings. But here's the problem. Because the early signs are so mild, they're often chalked up to aging or stress. That assumption leads many men to delay action, sometimes for months, sometimes for years. And it's in that gap between symptom and awareness that conditions can quietly worsen. One example? A man in his mid-50s who began waking up more often at night. He brushed it off, blamed it on drinking too much water in the evening. Months later, he noticed a slight hesitation when starting to urinate. Just a second or two, barely worth mentioning. Then came a slight burning sensation, a dull ache in the lower back. Still, he didn't act. When he finally did see a specialist, the news wasn't what he expected. It wasn't just an enlarged prostate. It was already pressing against the urethra, causing bladder strain. This scenario isn't rare. And the saddest part? Early intervention could have changed everything. That's why I want to bring awareness to the most common and most overlooked initial signs. Not to alarm you, but to empower you. Because the earlier you notice, the earlier you can act. Frequent nighttime urination, trouble starting or stopping the stream, discomfort while sitting for long periods. These are not just quirks of aging. They're often signals that the prostate is inflamed or enlarged. And while not all changes are dangerous, ignoring them can lead to complications that are harder and more invasive to treat later. But here's the hopeful part. Many of these issues can be managed naturally, especially when addressed early. Simple lifestyle shifts, smarter hydration habits, and targeted nutrition can all make a real difference. The key is paying attention and not brushing off what seems small. I want to emphasize that this isn't about fear. It's about awareness. The choices you make today shape your health tomorrow. Recognizing these early signs is the first step in taking control of your well-being. And if you're already noticing any of them, don't panic. Just listen to your body. Be proactive. Small, informed decisions have a powerful ripple effect. In fact, one of the most surprising strategies involves something that's probably already in your pantry. But the real secret lies in how it's prepared. And that's the bonus tip I promised at the beginning. I'll be sharing that at the end so you can get the full benefit without the common mistakes that reduce its effectiveness. For now, just know this. Your body speaks, quietly at first. The question is, are you listening? Coming up next is one of the most important insights. And ignoring it won't just limit your progress. It may lead to side effects that are entirely avoidable if you take the right action now. Let's talk about something that happens to millions of men every night, and yet most of them never think twice about it. Waking up once or twice to urinate. It might feel like no big deal. Maybe you had an extra glass of water before bed, or maybe it's just part of getting older. But what if I told you that this seemingly harmless habit could be an early red flag? One that points directly to a subtle shift in your prostate's health? The condition has a name, nocturia. And while it sounds technical, it's really quite simple. It's when your bladder wakes you up during the night because it feels full. Now here's the twist. A healthy bladder in a healthy male body should be able to hold urine throughout the night. So when that rhythm is broken, your body is trying to tell you something. We tend to normalize these interruptions. They creep in slowly. One night becomes two. Two becomes every night. And suddenly, your deep, restorative sleep is no longer what it used to be. Your energy dips. Your mood shifts. Even your immune system can take a hit. And while you might blame stress or poor diet, the real culprit could be your prostate. The prostate surrounds part of the urethra, and when it begins to swell, often due to inflammation or age-related changes, it puts pressure on the bladder. This pressure reduces the bladder's ability to fully empty during the day, leading to more urgency at night. You feel the need to go, but the stream may be weak, incomplete, or stop and start. Sound familiar? Here's something that might surprise you. Several large-scale studies, including one from the American Urological Association, found that men who reported nocturia as their first symptom were more likely to develop additional complications down the road. Not necessarily life-threatening, but disruptive. Conditions that impact your comfort, confidence, and even your independence. The good news? Catching this sign early gives you options. Real, tangible actions that don't require medication or invasive procedures. For instance, adjusting your fluid intake so it tapers off after dinner, avoiding bladder irritants like caffeine and alcohol in the evening, and incorporating certain nutrients like magnesium and zinc, known to support prostate function and reduce inflammation. Let me give you an example. A man in his early 60s who started waking up twice a night. At first, he ignored it. But he made a simple change. He replaced his post-dinner coffee with warm herbal tea made from nettle root, known for its natural diuretic properties and its ability to ease pressure on the prostate. Within 2 weeks, his sleep improved. His energy bounced back. And most importantly, he avoided escalation of symptoms that might have required more aggressive treatments. Now, I want to be clear. Not every case of nocturia means you have a serious prostate problem. But every case is worth noticing. It's about tuning in. And once you do, the next step is understanding what your body needs and giving it the tools to heal and function properly. There's also a deeper impact to consider here. Poor sleep doesn't just make you tired. It changes your hormones, affects your digestion, and can even alter how your body manages blood sugar. In other words, what starts as a nightly inconvenience may ripple outward, affecting multiple systems over time. That's why these details matter. One last thing to keep in mind. In the early stages, prostate inflammation is often reversible, but the window for easy, natural intervention doesn't stay open forever. That's why being aware and acting early is such a gift to yourself. In just a moment, we'll dive into a sign that most men overlook entirely, even though it may be one of the most telling clues of all. And skipping it doesn't just slow your progress. It can lead to avoidable setbacks that could compromise everything you've worked toward. Don't miss it. We've already seen how waking up at night to urinate isn't just a harmless disruption. It could be one of the earliest clues that your prostate is starting to demand your attention. But what if your body was offering you another clue, just as subtle and even more overlooked? Something you might not notice unless you're really paying attention. I'm talking about the strength and consistency of your urine stream. Now, this might sound like an odd thing to focus on. After all, who's measuring the pressure or the speed of their urination, right? But here's the thing. The way your urine flows tells a story. A story about what's happening inside your body, especially in and around your prostate. Under normal circumstances, your urine stream should be steady, strong, and uninterrupted. But when the prostate begins to enlarge, even just slightly, it starts pressing against the urethra, the very tube that carries urine out of the body. This pressure can cause a noticeable change. The stream becomes weaker. It may stop and start, or you may find it takes longer to finish urinating than it used to. And yet, most men brush it off. They figure it's just part of aging, maybe the result of dehydration, or even just nerves. But this small detail can hold major implications. The reduced flow isn't just a sign of inconvenience. It's often the result of a physical obstruction, one that, if left unchecked, can create long-term complications such as bladder strain, infection, or even permanent urinary retention. Here's where it gets more serious. The bladder is a resilient muscle, but when it's constantly forced to push against an obstruction, it starts to weaken over time. This means, even if the prostate is treated later, the bladder might not fully recover. The result? Persistent urinary issues that no longer respond to simple changes in lifestyle or diet. Let me share an example. A gentleman in his late 40s noticed he was taking longer in the restroom. At first, it was just an extra 20 seconds. Then, over time, he had to wait a moment before his urine would start to flow. He assumed it was stress from work, but the real cause was a gradual enlargement of his prostate. By the time he sought help, his bladder muscles had been overworking for years. Treatment helped, but not entirely. If he had paid attention to that small delay early on, he could have avoided the strain altogether. What can you do if you've noticed something similar? First, don't panic. Second, start tracking. Yes, actually pay attention. How long does it take to start? Is the flow consistent? Do you feel fully relieved afterward? These small observations can offer powerful insight. And then, start making adjustments. Hydration is crucial, not just drinking water, but when and how. Try spacing out your water intake throughout the day instead of drinking large amounts at once. Reduce or eliminate foods and drinks that can irritate the bladder. Spicy foods, excessive salt, alcohol, and caffeine are common culprits. There are also natural remedies that support urinary health. Saw palmetto, for example, has been widely studied for its ability to reduce prostate swelling and improve flow. Pumpkin seed extract is another excellent choice, offering compounds that relax the bladder and help maintain hormonal balance. These changes won't create a miracle overnight, but over time, they can reduce pressure, restore natural flow, and support long-term prostate health. It's about building a new relationship with your body, one based on listening and responding. There's one more layer to this. When urination becomes difficult, many men subconsciously start holding back fluids to avoid the discomfort or the inconvenience. But this leads to concentrated urine, which irritates the bladder and increases the risk of infection. It's a counterproductive cycle, and one that's completely preventable. And if you're wondering, yes, early intervention here is powerful. Men who address urinary flow changes early have significantly better outcomes long-term. And the best part? It can all start with something as simple as awareness. What your stream tells you may not seem urgent today, but it could spare you from a great deal of discomfort and loss of quality of life later. The next thing we're going to look at is something that most men would never connect to prostate health. And yet, it may be playing a hidden role behind the scenes. One that, if overlooked, could lead to frustrating symptoms and slow recovery. Don't ignore it. It may come as a surprise, but one of the most unexpected signs that something's off with your prostate doesn't start in your bladder. It starts in your gut. More specifically, in your bowels. If you've ever experienced persistent constipation, straining during bowel movements, or a feeling that your digestion is sluggish, your prostate could be involved in ways you hadn't imagined. Here's how it works. The prostate gland sits just in front of the rectum and directly below the bladder. So when the lower digestive system gets backed up, due to infrequent bowel movements, dehydration, or a diet low in fiber, it creates pressure on everything nearby. This includes the prostate itself. That pressure can aggravate existing prostate inflammation, trigger discomfort during urination, and even make it harder for the bladder to empty completely. Over time, this added strain increases the chances of developing or worsening conditions like benign prostatic hyperplasia, BPH, which is the non-cancerous enlargement of the prostate that becomes more common as men age. But that's only part of the story. Constipation doesn't just cause mechanical pressure. It can also lead to systemic inflammation. When waste sits too long in the colon, it alters gut bacteria and produces toxins that may eventually enter the bloodstream. This can set off a low-grade inflammatory response throughout the body. And for men already predisposed to prostate issues, that's a problem. There's growing evidence connecting gut health with prostate function. Some researchers have even referred to this relationship as the gut-prostate axis. While the science is still evolving, the message is already clear. Taking care of your digestive health isn't just good for your comfort. It's a smart way to protect your prostate. So what does that mean in practical terms? First, consider your fiber intake. Most men in the US consume far less than the recommended daily amount, and this has a direct impact on bowel regularity. Foods like oats, beans, lentils, flax seeds, berries, and dark leafy greens are powerful allies in keeping your digestive system moving. Fiber not only softens the stool, making it easier to pass, but it also feeds beneficial gut bacteria, the same bacteria that help regulate inflammation. Second, hydration. This one's simple, but often overlooked. Water is essential for softening stool and keeping everything in motion. If you're chronically dehydrated, especially if you rely heavily on coffee, soda, or alcohol, your gut will feel it, and so will your prostate. Third, movement. Physical activity stimulates intestinal contractions and helps prevent the kind of stagnation that leads to constipation. Even just a brisk 20-minute walk after meals can make a meaningful difference. Finally, avoid overuse of laxatives. They may offer short-term relief, but can weaken your natural bowel reflexes over time. Instead, focus on building habits that support natural, consistent digestion. There's a reason traditional medicine systems, from Ayurveda in India to traditional Chinese medicine, have long emphasized the link between digestion and male reproductive health. And modern science is starting to back that up. Let me give you a real-world example. A man in his 70s had been dealing with both mild prostate enlargement and chronic constipation. His doctor recommended a shift to a more plant-based diet, rich in legumes and fiber. Within a few weeks, not only had his bowel movements normalized, but his nighttime urination also decreased. He was sleeping better, feeling lighter and more energetic. No prescriptions involved, just strategic nutrition. If your digestion is sluggish, don't wait for it to become a crisis. Pay attention now, because often the discomfort you feel in one system might be the signal of imbalance in another. Prostate health is not isolated, it's interconnected. And when you support your body as a whole, your prostate benefits too. Now, the next thing we'll cover might seem completely unrelated at first glance. It's about a type of food that's found in nearly every North American fridge. But depending on how and how often you consume it, it might be quietly contributing to prostate discomfort and inflammation. Ignoring this factor can seriously limit your results, and in some cases, make symptoms worse. Let's take a closer look. By now, we've explored how gut health and digestion can place hidden pressure on the prostate. But now, let's look at something that's far more common, something most people consume daily without thinking twice. I'm talking about dairy products, milk, cheese, yogurt, cream, all staples in the typical North American diet. These foods are everywhere. But few realize the subtle yet significant impact they might be having on prostate health. Dairy, especially when consumed in large quantities or in its highly processed forms, can trigger inflammatory responses in the body. That inflammation isn't always felt as pain or swelling. It often lingers beneath the surface, affecting organs and tissues over time. And when it comes to the prostate, inflammation is a major concern. Here's what happens. Dairy products are rich in calcium, which in moderation is beneficial. But excessive intake can disrupt the balance of certain hormones, particularly vitamin D and parathyroid hormone. These shifts can influence cell growth in the prostate and may contribute to both benign enlargement and chronic inflammation. In fact, some researchers have pointed to high calcium consumption as a possible link to increased prostate tissue growth. And it doesn't stop there. Many commercial dairy products contain hormones, either naturally occurring or added during production, that can influence your own hormonal balance. When you're already dealing with sensitive systems like the prostate, that extra hormonal interference may create a burden your body quietly struggles with for years. Let me be clear, this isn't about demonizing dairy, it's about being aware. Many men who suffer from frequent urination, pelvic discomfort, or persistent inflammation find that reducing or temporarily removing dairy from their diet leads to noticeable improvement. Some report better sleep. Others experience reduced bloating, fewer nighttime trips to the bathroom, and even a stronger urine flow. Let me share a practical case. A man in his 50s was dealing with constant pelvic discomfort and fatigue. He had already tried supplements and hydration changes, but nothing seemed to help. On a nutritionist's advice, he removed all dairy for 3 weeks. Within 10 days, his discomfort subsided. By the end of the 3rd week, he was waking up only once per night, a huge improvement from the 3 or 4 interruptions he had been living with. It's not just about milk itself. Many processed foods contain hidden dairy ingredients, casein, whey, milk solids. These additives can sneak into salad dressings, protein bars, and even non-dairy creamers. Reading labels and understanding where dairy hides can make a huge difference in reducing low-grade, chronic inflammation. So what can you do if dairy is a regular part of your diet? First, try a short elimination period, just 2 or 3 weeks. Replace cow's milk with alternatives like almond, oat, or flax milk. Focus on whole, unprocessed foods. If you see improvement in your prostate symptoms, you've gained valuable insight. Then you can decide whether to reintroduce small amounts of dairy or avoid it altogether. Second, balance your calcium intake with magnesium and vitamin D, 2 nutrients that work closely with calcium to regulate muscle function, including the bladder and pelvic floor. And third, consider fermented foods like sauerkraut or kefir, non-dairy options available, which support gut health and reduce systemic inflammation. This isn't about radical dietary change, it's about discovering what works best for your body. Everyone is different, but ignoring the possibility that something as simple as your morning latte or cheese snack could be silently contributing to your symptoms is a risk not worth taking. Understanding the connection between common foods and internal inflammation can be the turning point in your prostate health journey. Often, what seems harmless or even healthy may be interfering with your body's ability to heal and restore balance. Now, we're about to reach the most critical piece of this journey, and it involves a natural ingredient that's not just beneficial, but remarkably effective when used the right way. The method of preparation makes all the difference. And getting it wrong doesn't just reduce results, it can even create problems. Don't miss it. Throughout this journey, we've uncovered subtle signals, from nighttime urination to weakened flow, constipation, and dietary triggers, all pointing to one thing: the importance of listening to your body. Now, we arrive at the moment many of you have been waiting for: a practical, natural way to support your prostate health, and more importantly, the right way to do it. There's a natural ingredient that's been quietly making waves in holistic health circles for its powerful support of male wellness. It's widely available, affordable, and often overlooked: pumpkin seeds. But the real secret lies not just in the seed itself, but in how it's used. Pumpkin seeds, especially in their raw form, are packed with zinc, phytosterols, and essential fatty acids, all of which have been shown to reduce inflammation in the prostate and support hormonal balance. Zinc, in particular, is highly concentrated in a healthy prostate and plays a vital role in reducing the size of the gland when it's enlarged. However, simply sprinkling a few seeds on your salad won't unlock the full benefits. The way these seeds are prepared and consumed can drastically affect their potency. Most people roast them or buy them pre-salted, but high heat and added sodium reduce their nutrient value and can counteract the anti-inflammatory benefits you're seeking. So here's what actually works. Take 2 tablespoons of raw, organic pumpkin seeds. Rinse them briefly under cold water. Then, soak them in a glass of room-temperature water overnight. In the morning, strain and eat them on an empty stomach, ideally before any coffee or heavy breakfast. Why this method? Soaking the seeds softens their tough outer shell, making the nutrients more bioavailable. It also helps remove naturally occurring phytic acid, which can block the absorption of zinc and other minerals. Eating them first thing in the morning allows your body to absorb those nutrients efficiently without interference from other foods. Many men who have adopted this habit report noticeable changes within weeks: less nighttime urination, stronger flow, reduced pelvic tension, and even increased energy. And because this method is entirely natural and non-invasive, it can be sustained long-term as part of a healthy routine. But just as important as knowing what to do is understanding what not to do. Don't rely on salted or flavored pumpkin seed snacks from the grocery store. Don't combine them with dairy-heavy breakfasts, which may blunt their absorption. And don't expect instant results. Natural healing works gradually, through consistency and care. The beauty of this approach is its simplicity. No pills, no side effects, just a quiet, powerful shift that supports your prostate from within. And more than that, it's a reminder that our bodies respond best to what's natural, to what's gentle, and to what's given with attention. The more you listen, the more clearly your body will tell you what it needs. You've now taken in a wide spectrum of insights. And if you've come this far, it means you care, not just about avoiding problems, but about cultivating lasting wellness. That's something to be proud of. So here's what I encourage you to do. Take one insight from what you've learned today and apply it. Just one. Whether it's changing what you drink at night, swapping dairy for a plant-based alternative, or trying the soaked pumpkin seeds, commit to it. Your body will thank you. And if you found this content helpful, share it. You never know who might be quietly dealing with the same symptoms and desperately looking for a natural, practical solution. Leave a comment, like, or subscribe if you'd like to continue this journey of proactive, empowering health together. Because in the end, knowledge is powerful, but action is transformational.